And now I'd like to introduce Manager for Chamber Insurance and Benefits, Deb McCary. Deb.
Good morning. My name is Deborah McCary, and I am the Insurance and Benefits Manager at Chamber Insurance and Benefits. We are a wholly owned subsidiary of the Las Vegas Metro Chamber of Commerce, and we serve our members by helping them with health insurance questions. And as I know you are probably well aware, the Affordable Care Act keeps changing. In fact, there have been nearly 40 changes made to date, and there's likely to be a lot more in coming months. In today's presentation, we're going to cover several items: insurance exchanges, Medicaid, the Nevada Health Co-op, small group definition in 2016, the CADILLAC tax, consolidation of major insurance companies, the overall effect of the ACA, and some next steps for business owners, including some reporting forms that are now being required. And hopefully this will prove to be valuable and helpful to you. Now, beginning with a brief overview of the insurance exchanges, these are also known as marketplaces, and they were established in each state to give more choice to consumers, especially those that needed individual or family coverage and small group employers. Now, in Nevada, our exchange is known as the Silver State Health Insurance Exchange, and it's also called the Nevada Health Link. And there are also some private exchanges in the Valley, especially here in Las Vegas. Now, both the Nevada Health Link and most private exchanges are linked to what's called the federally facilitated marketplace. This is where subsidies can be sought, and they both handle primarily individual policies. The small group platform hasn't received very much traction to date. Now, the exchanges provide assistance for consumers seeking government subsidies, like I mentioned before, and these subsidies can be obtained from the Silver State Exchange or some of the private exchanges. The recipients of these subsidies typically earn between 138 and 400% of the federal poverty level. And we're going to see a chart on the next slide illustrating those levels of income in 2016. Medicaid, who is eligible as a result of the expansion, it's interesting to note that nationally there are now 60 million people covered by Medicaid. And in Nevada, because our governor chose to expand Medicaid, individuals with incomes up to 138% of the federal poverty level can qualify for Medicaid. Now, this chart displays the 2016 federal poverty level numbers, so you can quickly see that a family of four earning less than $33,465 can apply for Medicaid. And anyone earning more than 138% but less than 400% may qualify for either a subsidy or a tax credit. But to do so, they must purchase their policy through a health insurance marketplace. Now, what does all this mean financially to the state of Nevada and its citizens? Some important data that we've sought and found is that 70% increase has taken place in Nevada's Medicaid population since the expansion. Now, this represents 22% of Nevada's total residents now receiving benefits. And there are approximately 235,000 new participants, which represents a 70.2% increase in participants since the expansion. Now, to administer this increase in enrollment, Nevada hired 350 new employees, and the cost of this additional increase in administration is over $50 million. Nevada must begin paying a percentage of all Medicaid costs in 2017, and that percentage will cap at 10% of all Medicaid costs by the year 2020, with no definite increase in medical resources. The fear is that this most likely will result in longer wait times for everyone and potentially lower quality of care. But of course, we want to be about solutions, and there are some solutions that the state is working on. The acquisition of more doctors, physician's assistants, nurse practitioners to be added to provider networks. And you may have noticed an increase in concierge doctors and quick care centers that are popping up around the valley. Solutions must be found because when access to providers is difficult, emergency rooms become more crammed, which puts everyone at more risk since the truly emergent cases could be potentially hindered from the same level of immediate care. Other solutions that are starting to come into the horizon, and you'll see more and more of, I'm sure, are what are known as direct primary care facilities such as HTU Health Centers and Medline, to name just a couple that recently have been in the news. Now, hopefully, over the course of the next couple of years, many more solutions such as these will emerge and bring some relief to overcrowding of our emergency rooms and longer waits to see our primary care doctors. The Nevada Health Co-op, we want to share what we know about the recent announcement given by them. First of all, who are they? The co-ops in general were created under Obamacare to foster competition in areas where few carriers offered plans, and there aren't a lot of carriers in Nevada, so the Nevada Health Co-op was created in 2012, along with 22 others serving 26 states, and they began providing insurance coverage in 2014 with Obamacare's first open enrollment period. Now, their recent announcement is that there is a termination of their operations as of December 31st, 2015. There are other co-ops in other states that are experiencing the same kind of outcome. 6 that I know of have closed to date, with many others looking like they're going to be headed in the same direction. Who is overseeing the Nevada Health Co-op until it closes? In October, the Department of Insurance filed a petition with the court to take over operations, and this is, of course, is in the interest of protecting our consumers. Now, if you are currently holding a health insurance policy from the Nevada Health Co-op, what are your options? Right now, the instruction continues to be to keep your current policy. Now that we're in open enrollment, you can go and shop another carrier. Policyholders should seek out advice from their health insurance professional, since a change in this directive is always possible. Moving on to the small group definition in 2016, the Affordable Care Act prescribed that small group was going to change to include groups of 2 to 99 full-time employees. However, recently, House Bill 1624, which is the small group expansion bill, was voted on September 28th and passed, and President Obama signed it, which allows the states to have greater flexibility in determining their own small group market instead of relying on a single national standard. Likewise, the Senate Bill 1099, which is also known as the PACE Act, was voted on October 1 and passed with unanimous consent in the Senate, and the President signed it. And a statement recently was placed by the Nevada Division of Insurance. They issued a statement on October 12th regarding small group definition, which appears that Nevada has sided with small group remaining in Nevada at 2 to 50 full-time employees. But we are waiting for an official confirmation from the Department of Insurance, and once the Chamber receives that, we will make that available to our members. Now, what are some options for employers to help control their premium increases that you may be experiencing? If you do experience a significant increase, first of all, you always want to consult with your health insurance professional, and you can talk about things such as possibly raising your deductible or raising some of your co-pays and co-insurance levels. You can look at the pricing if you raised your maximum out-of-pocket amount. There are some other options that are out there that you should talk to your insurance professional about as well to see if they might be a good fit for your group, such as self-insurance. Usually that works best for mid-sized to larger employers, usually with at least 40 employees or more. Group captives have been formed that are very similar to that, and that is another subject that you could talk to with your professional. Professional employer organizations that have a large group plan connected to them. And also, some of the smaller groups up to 99, they are being offered to early renew. That is an option that helps for 1 year only, but it could be something for you to look at. The CADILLAC tax. Now, there is bipartisan support for the CADILLAC tax. This is set to take effect in 2018, and it calls for a 40% excise tax on the amount of the aggregate monthly premium of each primary insured individual that exceeds the year's applicable dollar amount limit, which will be adjusted annually to the Consumer Price Index plus 1%. That's a lot of legal language, but given that pace of healthcare growth beyond that of general inflation, this means that the tax is destined to outgrow itself in short order, and many employers will be impacted by the cost of the tax and enormous compliance burden that this tax will create. An estimated 60% of employers now will be subject to this tax by 2022, which could force many to consider dropping employer-sponsored insurance altogether. There have been 4 pieces of legislation that have already been introduced in the House and the Senate with bipartisan support to attempt to repeal this tax. So they do have significant support, and it is anticipated that the CADILLAC tax may be overturned. If you would like to Google these bills, they are House Bill 879 and 2050, and Senate Bills 2045 and Senate Bill 2075, which Senator Heller co-sponsors Senate Bill 2045. Some other changes are happening in the carrier world that you may find interesting. There's a consolidation of major insurance companies happening. For instance, Aetna buying Humana, Anthem buying Cigna. And really, this leaves us just with 3 major insurance companies in the United States. Now, some concerns in the industry about what this could mean. There's less competition, naturally. This could result in less plan choice ultimately, and what we may fear most is higher premiums. This same pattern of consolidation, interestingly enough, is also happening with hospitals, physician practices, pharmacy benefit managers as well. As you can see, changes everywhere continue to happen, and day by day we are all learning more about what the actual Patient Protection Affordable Care Act will mean for the American citizens. Now, the overall effect of the ACA, it has increased the total number of people that have some type of insurance. The lion's share is via Medicaid. There have definitely been some increased premiums, deductibles, copays, and out-of-pocket maximums. To date, there are 21 new taxes that have been introduced. And in Nevada, we continue to learn from members that there are increased waiting times to see a physician and reduced quality of services. So it's so important that we all continue to have conversations with our legislators and those in power to make changes and decisions about the unintended consequences that we are all experiencing. Some next steps. First of all, you always want to contact your insurance professional to discuss your options. Everyone's case is different. Don't be afraid to ask questions until you are absolutely certain you're compliant, because even those who are in the industry like myself, we have to constantly read and try to keep up with all the moving parts of this law. So don't be shocked to hear even your professional say, your insurance broker say, I'm not sure about that. Let me double check because it may have recently changed. They aren't covering up anything. This is the world we're all trying to navigate through together. And also, with new changes happening every year, it is definitely wise to reevaluate your benefits to find the best solution for you and your employees. Never assume that just auto-renewing will make everything okay. There are plans that are discontinued every year. Auto-renewing without reviewing means that you just signed up for the alternate plan that the carrier chose that they thought would most closely match what you had last year. But most consumers would prefer, I know I would, to know what they have signed up for. One last thought to share regarding choice of plans, especially on the state exchange and the private marketplaces. Since these both offer access to federal subsidies, it's important to make sure that you're reviewing the provider networks available through each plan, and yes, they are very different from carrier to carrier and even from plan to plan. And also, if you want access to PPO plans especially, your best bet might be to seek out private exchanges for more plan choice. One additional thing, especially for the mid-sized employer and large employer, is you need to discuss with your health insurance professional or your financial advisor the new employer reporting forms that you are obligated to complete. Those are issues that you need to work through to make sure you are thorough and compliant. And with that, I have finished my presentation. I open this up to any questions that you may have.
Again, if you'd like to ask any questions, you can type them into the chat box in the corner, left bottom corner of the screen, or you can press *7 on your phone to unmute your line. And the period for open enrollment has already started.
Yes.
And so when is the end of that?
The last day of open enrollment is January 31st, 2016. However, if you would like a policy that is in effect for January 1st, that must be completed and paid for payment by December 15th of 2015.
Wonderful. Well, it doesn't look like we have any questions. Again, if you do end up having a question, you can always contact Deb at the number on the screen right now. You can just call the chamber and we'll make sure that she gets all of your questions. So I want to thank you so much, Deb, for the presentation today, Chamber Insurance and Benefits for presenting, and thank you all for joining us today.
Thank you.